Provisional accreditation, that means new schools that don't have full accreditation yet, but they're just kind of going through the process to make sure they have all their marbles intact, all their ducks aligned to get full accreditation. Hi guys! So sorry for running late today. It has been a busy Monday. I've been traveling all day and I was running late. I was trying to make it on time, but I didn't. So thank you guys for the ones that are here for sticking by or holding tight. Hopefully more people start to come on. If you guys know people that like came out or left because they didn't think there was e-shadowing or was waiting around, there is e-shadowing today. There's e-shadowing every Monday unless I say otherwise. Sometimes I do run late, not ever really this late, but I just had a lot going on. But thank you guys again for just, being patient with me. So we're going to jump right into the session. Of course, it's going to be cut short. It's going to be like a little short today. It's probably going to be like 45 minutes. I'm going to try to finish by like 8:15 or 8:10. So, of course, we're going to do Q&A. We're going to probably do like 10 minutes. Waiting is still worth it. Oh, thank you so much, guys. It's going to be another great, case study. We're going to do like 10 minutes of answering questions. We're going to jump right into the case study, okay? 10-15 minutes. Anybody have any questions that they would like answered, questions, concerns about PA school, anything? I'm just uploading the case study. The case study is fun. It's something different. So, of course, it's always a learning opportunity. Any questions, guys? Oh, people are trying to log in. Great. Let me see just some just housekeeping. Remember, I'm not taking personal statements. I do no longer take personal statements, like at least via email. Everything is now done through the app. I can post the app link. I released the MedSembly app so you guys can connect to mentors in your area, not just your area, but just mentors all over the country. There's a lot of mentors that's coming on the app. I think mentors from Washington, all over. But so utilize the app. I'm not the only one on there, of course, so that's the point of it. So I really want you guys to utilize it. It's just really overwhelming for me to have to handle all the personal statements and stuff. So I recommend you, if you need a personal statement revised, whatever you need for PA school especially, utilize the app. Alrighty? Because I'm no longer taking like sending me personal statements via email or asking me on Instagram. Dang, things just all over the place today. If Zara continues to do that, then I'm going to have to stop really quick and get her together. All right, the app is MedSembly. I'll put my Instagram account here. All right, still haven't heard back from any of the programs I applied to, and is it okay to start worrying? Don't worry at all. It depends when you applied as far as waiting to hear back from a program. If it's been like more than 2 months, typically, they wouldn't wait 2 months to get back to you, 2-3 months to get back to you. Then it could mean that, it's a rejection, unfortunately, or that, sometimes they look through other applicants after kind of interviewing like a bunch of people, or kind of like as they go through their interview cycle, they may like return back to the application cycle or old applicants that they were probably interested in. So you just never know. Don't give up faith. Don't give up any hope. If, it looks like no schools are getting back to you, then just kind of be prepared to reapply again and get ready to just start perfecting yourself and figuring out what you need to do next to get into PA school, or where you went wrong in the application process, your stats, whatever it is. What do you think helped you stood out when you applied? I feel like I always say the personal statement. I'm so big on, making sure your personal statement is great, because as I always say, it's the best way for them to get to know who you are beyond your stats, because your stats are one thing, but who you are is really, the foundation of being a great PA, other than just having the brain, which is your stats. How many volunteer hours should I aim for? I don't think there's a specific set amount of hours to aim for as far as volunteer. I think shadowing there is, of course, healthcare hours there is. But volunteer, I feel like as long as you have at least 50 hours, you should be good. Maybe 100, aim for 100. I don't really remember how much I had, because it wasn't such a big, like a stickler for me for PA school, but just have a decent amount. Yes, do you think you can do another quick tutorial on how to download the app and do the home screen? Yes, and I'm also going to post the app link. I posted it right there, you guys. The app is not in the App Store. You have to access it through the link I just sent you guys, or I just posted. And then my IG, I'll post it my IG as well. That's how to get in contact with me. I'm at MedSembly. All right, any more questions, guys? I'm so sorry. I know it's down to like 50 something students. I'm so sorry I was late. I know I said 7:15 and then it's now like 7:30. I'm so sorry. It's been a hectic like August, July, just been so hectic. A lot of bad news, bad stuff going on. So just trying to get things together. So any other questions about PA school, the application process, healthcare hours, and I have my IG. My IG, I have videos that have a ton of information. If you scroll through my IG, there's information. I periodically post, information about more than periodically, often post information about PA school on my story. So next week is September 6th, right? I believe the first week of September we will have a guest. But for now, I'm going to show you guys the app, okay? We'll move on to the app if there's no question. A tour of the app, a quick tutorial. All right, so you click on that link, and it's going to take you. Great questions, guys. How many shadowing hours do you think is okay considering we are having it virtually? I always say at least 50 shadowing hours. I know people have a lot more than that. Some people have 100, some people have 200, but I think at least 50 hours is good. If you can, try to get in-person shadowing. I do have some PAs that offer in-person shadowing. Of course, it's not PAs from every state yet. That's the goal. But I have PAs from various states, especially Texas, Florida, that offer in-person shadowing. Sometimes there's a process to go through with that, but you can hop on the app and see like any PAs that do offer in-person shadowing in your area. And if you don't worry. If you don't find someone, don't worry. Like I said, this is something new. It just released last week or almost 2 weeks ago. So just keep constantly expecting new people on the app, new PAs that can help you, especially in your area. Yeah, I think schools will not be as strict with volunteer and shadowing. They definitely won't be as strict. And if you can do like volunteer work online, like Big Brothers Big Sisters, is mentorship. That's volunteer. You can sign up for Big Brothers Big Sisters. I do that still right now. I actually need to call my little sister, but you can do Big Brothers Big Sisters. They do virtual meetups. Like you go on Zoom, do a Zoom call, whatever. The first 6 months, because of the pandemic, it's virtual meetups for 6 months. Boom, that's your volunteer, and you're mentoring whatever it is, helping the next generation. So that's one suggestion for virtual shadowing, or you can get a virtual hours. I said I do a lot. I know. What's your opinion on applying to a school during this cycle that is aiming to have provisional accreditation status by the start of the first class next year? Provisional accreditation, that means new schools that don't have full accreditation yet, but they're just kind of going through the process to make sure they have all their marbles intact, all their ducks aligned to get full accreditation. As far as provisional accreditation and applying to a school like that, I say that do your research, of course, because you don't know their pass rates because they don't have an inaugural class yet to compare PANS scores, so you don't have that. So what to go by is, of course, the school. If they're already a known school and they have like great programs already, they have a great medical program, and they're just out creating a PA program, then you know that their PA program is likely going to be good. Like if, for instance, okay, even though UF already has a PA program, I went to UF. If they didn't have a PA program, but UF is a well-known school, especially in South Florida or the South, then you know that if UF was still in a PA program, that a lot of people would be applying, or that provisional accreditation is nothing because they're already a great school. They're more than likely going to have a great PA program. So if they're a well-known school producing, have well-known programs, especially medical programs like well-known nursing programs, pharmacy programs, medical schools, then you know that more than likely their PA school is going to rock. If it's a new school, an unknown school, whatever, I would hold back until you kind of see what they have to bring to the table. But if it's like an established school that's just, expanding to physician assistant studies, then go for it. Because you know that they're going to produce greatness already, because based on their track record. That's not always the case, but that's what you do when you apply to college, right? You go out for schools that are, that already have what you're looking for or have that status. Should we apply to schools that require a minimum of shadowing hours if we have not met that minimum? Yeah, I mean, it's fine to apply to a school that have that, as long as you're going to meet that, as long as you're going to get that by the time, you apply. And I wouldn't really, if you're going to apply this year, then try to get that by the time you apply. Like, it can be your hopeful school, but you don't have it yet. But by the time you hit submit, you'll have it. How early should we be taking the GRE and studying for it? I say with like if you're a senior or a traditional student, then do it your senior year in college because the GRE requires at least 6 to 8 weeks of studying. I say typically 6, but if you have a lot on your plate, then take some extra time to study. But if you're not, and I say like your last semester of college for traditional students, because that's when you're not as busy. You're not like necessarily a full-time student. You've gotten most of your core classes, I'm guessing, should be done with. So it's just finishing off, just getting ready to graduate basically. So you should have more time to study for the GRE. And if you're a non-traditional student, then basically take it when you're done taking all your prereqs and you're just kind of, it's like one of the last things you kind of have to do. I don't recommend you take it like necessarily like as you're applying because it's hard to apply and then have other things to do and study for, especially something like the GRE. Get it out the way. Let it be like a lot of the things you get it out the way. Like certain things I just rather you complete before like the application cycle even opens. I mean, not before the application cycle opens, but before you start the actual application process. Like you don't have to finish your classes. You don't have to finish shadowing. You don't have to finish volunteering, but as far as the GRE, things as far as most of your classes should be done with by the time you at least click start CASPA. So I hope I was able to help. How much involvement can PAs provide in the community? A lot of involvement, a lot of, these, walk-in clinics, community clinics, health department, a lot of involvement, especially with COVID, all these travel opportunities, a lot. What do you think of only applying to schools that do not require the GRE? I mean, you can if you want to. I don't think there's anything wrong with it. But applying to schools that do require the GRE would increase your chances of getting in because you're applying to more schools. But if you're great with, where you're at as far as your GPA and everything else, then go for it. All right, guys. Is it possible to work and go to PA school? I'd say no. I advise against it because it's very hard. PA school is taxing on its own. So imagine having to work. If you do probably your first year of PA school on like a weekend job or something, I mean, the weekends are really studying too. So or every other weekend, maybe like a little side hustle thing that you just make little money here and there. But the best thing I recommend you do is just chuck it up and take out the loans if you have to. All right, guys. The app. So, why is it showing this? Oh, because all right, so you're going to click the link really quick. Any more questions? Okay, it's 7:40, so just so we have time to go through the case study, you're going to click the link and it's going to show this, right? You're going to want to, can you take 2 years before applying to PA school? Is it possible? Yeah, you can take as many years as you want before applying to PA school. However much time it takes for you to be prepared and feel like you're ready to, for that rigorous education. All right. So you click the link, it'll take you to this. If you're doing it right now on your phone, whatever, you'll see this. So you want to save it to your home screen as an actual app because right now it's on a website. This is, early. We're still testing it, so we're not going to just put it right there and then and there in the app store. You want to make sure that you guys actually like it and that it's going to be something that's going to bring value to all of you. So it's just a link for now that you can save as an app. So this is it. If you have iPhone, I'm sorry, I have to figure out the Android way. Hopefully Android's the same way as far as saving it as your home screen, but this is for iPhone because this is what I have. So you click the middle button, that arrow. You click that, and you're going to scroll up. It's going to say, it's going to say add to home screen, and that's what you click. As soon as you click that, you can add it to your home screen. I mean this, where you see all your other apps, okay? And that's it. So you won't ever have to put your password in again. You won't ever have to, sign in or worry about it putting in a PIN or anything like that. You just access it like you access Instagram. So once you do that, it's going to be on your home screen right here. You can click it, and then it takes you to the app, loading, boom. So then this is like the main page with where you can see the matches once you and then you can scroll through and see like PACs, PASs in your area. Some people don't upload pictures or mentors. So you swipe through, you see someone you like, for instance, Melanie, you read about them. If you're interested in connecting, then you click here and then you click send a message and you get it started. And you can see about what they offer, their strengths, weaknesses, things that they're willing to help you with, the credits that they're offering these services for. And that's basically, you swipe, and then you say you want to connect with the mentor, you need help with an essay or something, anything like that, you click, the first thing is to buy credits for our paid services, which is essay revision, mock interviews, and resume slash application review when revising. So the mentors, you'll see the credits that they want for each service. So say they want 100 credits, so you need 100 credits. You go and buy the credits. Really easy. 100 credits is $50. Go buy now or add to cart, and then that's it. And we receive it, and then you get, and then you can do whatever, contact your mentor or whoever you want, the coach, to buy the credit, and to use the credit. And you can buy as many credits as you want. You can, the credits never expire. You can use it whenever you want. If you want to just get things started and you plan to apply to PA school next year, but you want to get things started, you can do that. And then if you go to PA school next year or 2 years from now, whatever, the credits will always be here. As long as you have credits, they'll always be there. You'll also receive an email when you purchase the credits to show proof and how many credits you have. I receive a notification, so we have that documented. So then you go to community. You can see I post a bunch of resources, stuff to help you guys out. You guys can post stuff too. It doesn't have to just be me. If you click start a discussion, then you can type whatever you want to discuss or have questions about too. I already have some links up here if you want to access some helpful links. Like, they're really helpful stuff that I created and that other students posted. This is the link to the app. The app is not in the app store. This is the link to access the app. I don't know how to pin stuff. I don't think pinning is possible. So you just click that link. And then if you click connect, you can see everybody on the app. Right now we have probably 400 users, PACs, PASs, all the users on the app. Some people have pictures, some don't. So Kalima is a student. Nicole is a healthcare professional, PA. So, and then you go to chat. These are some students that I've already been chatting with. Don't worry about myself. That was Tess. But you can chat with people, see your inbox, and then you can see your profile. If you click this tab right here, you see your profile anytime. Edit your profile whenever you need to. See your favorites list, hide favorites, show favorites, anybody you favorited or want to connect with in the future. And then shopping cart if you plan to buy credits, settings. There's a full guide on the settings page as well. And that's basically it. You can share the link with your friends, whatever. So thank you for everybody that's on the app. Like I said, we have a lot of things we're doing with it. So get excited. We're still bringing on some mentors. If you don't see anyone in your area, if you don't see anyone that can help you, if people haven't been responding, don't worry. Don't worry. And as long as if you message someone, they don't respond, just message them again. Right now, it's via email notification. So not everybody checks their email. Not everybody receives it. If you want to do phone notifications, like to get a text message, you can do that as well too on the app. We're going to set that up. So as soon as you do phone notifications, you're going to get it like a text message. So you can do that as well for easier communication. All right, we're going to start the case study. Okay, this is it. August 3rd. Case study time. All right, guys. Case study. If this is anyone's first time ever doing any shadowing session with me, you know that I'm an emergency medicine PA, so everything I do is centered around the ER, cases that you would typically see in the ER. A lot of my cases are kind of like extreme, but they happen. So just this is a teaching purposes as far as like the foundations of the ER. You're not meant to know every diagnosis or how to diagnose or probably how to diagnose, but all the medicine, you don't have to know that. It's just the basics of the ER that you need to be familiar with, or that I encourage you, or it would be great to be familiar with at the stage that you're in. All right, so as you all know, pros to remember, worst first. Remember if this person is sick or not, are they ever going to be able to go home or not? And this is all part of your disposition, figuring out like what's going on with the patient, making sure that they don't go home and pass and die. Worst case scenario, always want to cross your T's, dot your I's, make sure you're doing a great job along with perfect documentation or near perfect, or documentation that affirms everything that you do. Okay, and remember, you always have people there. The great thing about working in the ER is you have a great support system and team of people behind you. You have your attending physician, you have specialists, people on call that you can contact if you need help with anything, along with, nurses, the nursing staff, radiology staff. If you have a question, whether they're like, if you want to image the arm, but you want to see if they can also catch the wrist, the forearm, but want to see if you can also catch the wrist, you can just call radiology. So there's a lot of support and teamwork in the ER. All right. So, case study today. An anxious mother presents to the ER with her 3-year-old son complaining of a forehead laceration. So, do vitals look great or not great to you guys? And if anybody wants to come on for this case study, feel free to do so as well. All right. Is it a little delayed or people not answering? Okay, I'll answer. Okay, great. Perfect. Okay, I want you guys to be proactive and answer. So heart rate is actually okay for a 3-year-old. Kids, pediatric vitals are a little different from adults, especially heart rate. We don't really consider blood pressure. We don't ever really check blood pressure on kids. We probably don't start checking blood pressure until they are probably like more in the adolescent years. So it's okay if you don't see a blood pressure for kids, because it's not like, that they're not going to have like extremely elevated blood pressure unless they come in like septic or whatever. But I don't ever really see the nurses, or they don't really take blood pressure in kids. The most important thing for kids, of course, are temperature, heart rate, and oxygen, like making sure they're breathing, because a lot of kids have asthma. A lot of the times they come in for respiratory complaints. So those are the most important vital signs in kids. But of course, blood pressure is important. It's an important vital sign, but it's not as important in a child as it is in an adult. So yeah, I honestly still don't know all the pediatric vitals. Like, don't remember like what's normal, what's not abnormal, unless it'll be in red on the chart. I know like temperature is normal. It is kind of the same across the board, but heart rate, kids typically have higher heart rate, but I don't remember like the exact cutoff because it changes with the age groups. So a 3-year-old is going to be different from a 10-year-old, is going to be different from a 15-year-old. By the time you reach age 15, you're basically going to have like the same vitals as adults. So you'll see it'll be red, or like it'll be like marked off if something's abnormal with the vital sign anyway. But just know that pediatric patients, their heart rates are, it's okay for them to be tachycardic because that's just normal for them. All right. And their respiratory rates is the same. All right. So, the patient comes in with an injury. So you got to be thinking what's going on. How would you treat this? What is this patient going to need? All right. But the vitals are good. This is pretty straightforward, but it's just more so teaching you like the ins and outs of this specific case study. All right, so what are some important questions you'd want to know about this patient, or whatever this patient is coming in with? What are some important questions? And if you guys know how I like to present, it's also going to help you with just when you present to patients in general, or when you have to see patients in general. If you remember this PowerPoint, the flow of this PowerPoint, how I do it, I start off with the chief complaint, then I go to focus history, then I go to the physical, then I go to, if you need any labs, imaging, then the disposition and all that. So that's basically how it is when you actually go see the patient. So pay attention to, if you know how my case studies are, my case study PowerPoints, then you'll know what's next. So you'll be prepared to type, okay? So yes. All right. So of course you want to know what happened. How did it happen? So say that mom says that, baby was playing with his big sister, running around the house, and he hit the coffee table and fell back, and immediately started crying, and she came and she saw that cut on his forehead. All right. What are some important questions that you'd want to know? What was done immediately after the injury? Sure. Any loss of consciousness? Yes, Ernisha, perfect. That's one of the first things you want to know, especially with kids. Did baby pass out? A lot of times they probably won't know if baby passed out because, parents are, on one side of the house, or they're on the phone, or they're in the kitchen, and kids playing around in the living room, or, the family room or whatever. But you'll typically know, because if they cry right after, then likely they didn't pass out. But if, something happens, boom, and you hear like quiet, or if you hear a loud noise followed by quietness, and you know that, oh my gosh, possible loss of consciousness. Sometimes they can't answer that. Sometimes they can. Sometimes they'll say that, oh my gosh, I heard a boom and the baby was just kept crying. Likely that they didn't pass out. But asking about loss of consciousness is very important. All right, the kid experiencing any symptoms besides pain? That's fine, but you got to be a little more specific with your questions. Okay, so hi mom, my name's Rodeline. I'm the PA, blah, blah. So what's happened? Baby fell, was running around, hit his head on the coffee table. Okay, was this witnessed or not? Important question. Did you witness this? Remember I said that a lot of times they won't witness it. Was this witnessed or not? and you have to document everything mom said. Mom says, oh, I was around in the house, but I wasn't like in the living room. I was in the kitchen. So technically it wasn't really witnessed, but she can say, oh, his 6-year-old sister was there playing with sister, patient fell, sister witnessed the fall, blah, blah, blah. And sister is 6 years old, so you can give some information about the fall. Okay, was it witnessed? You want to know. And then you want to know any loss of consciousness. Oh, no, he was crying right after. I don't think he passed out. Okay. You want to know any other injuries that you notice. That's what you can ask that rather than any other symptoms. You can ask any other injuries that you notice. Did he also, bang his knee? Did he hit his arm? Did you see like a swollen lip? Any other injuries you notice, mom? Oh no, everything else is fine. He's moving his legs fine. He's moving his arms fine. He's not touching anywhere else but his head. Okay, boom. And then another question you want to know is any other injuries? No trouble walking, trouble moving any muscles or anything, arms, legs. Mom already said no. And then you want to know any other symptoms as far as you want to ask specifically any vomiting, any nausea or vomiting. No, he did not vomit. Do you know how fast he was going when he could have, let's think if they're like running around playing, and he's 3 years old, his gait's not all that. So he's probably not running like the speed of lightning. But so I said any nausea or vomiting. No, he did not vomit. That's important to ask. And I'll show you guys why later. Questions about cognition, speech. The thing with kids is that that's good to ask, but that's necessarily you can ask like any changes in behavior. That's another important question to ask. Is baby acting normally? Like, did he like after like during the car ride to the hospital want to get on the phone and watch like Coco Melon or something? That's his normal behavior. Any changes? Does baby appear more somnolent, like not wanting to play, closing his eyes, being sleepy? Those are questions that you want. You don't really say cognition or speech, or you can say any trouble speaking. That's kind of change in behavior. You say change in behavior, and then you can ask, more questions to go off of that. Because kids, you'll notice that they're not acting normally, and mom will say that. So yeah, alert is changing like basically behavior, like they're more drowsy, they're sleeping, they're not wanting to play, they're not as loud, they're not laughing, playful, whatever. Specifically for something happening to a child or for everyone. It's necessarily like, yes, for everyone, but of course you want to tailor it to that child. So you're not going to say, changing, but you can say changing behavior for adult, but you could say, because they're an adult, you could say any trouble speaking, any, changes in vision, speech, whatever, walking. But for kids, you say, did she not want to watch her favorite show? Just tailor it to the audience. And other important questions. And then of course for kids, the witnessing question. For witnesses, you want to ask for if it's an adult, that of course if it's like a sound adult, they're alert oriented ×3, whatever, you don't necessarily have to ask any witnesses. Maybe if it's an assault, yeah. But if it's just like an injury, you don't necessarily ask if anyone witnessed it. Like for kids, because he can't say what happened. For babies, toddlers, then yeah. But adults, you don't necessarily ask for witnesses unless it's, of course, an MVA or a assault. So yeah, of course, we talked about being alert. We talked about nausea, vomiting. We talked about alertness with changes in behavior. We talked about mechanism of injury. The mechanism of injury, we said, did he pass out? Was he running fast? Getting hit, slamming your head on the coffee table is completely different from a hit and run, right? Even if it was like a 2-year-old and brother was coming really fast on the dirt bike and boom, that's a completely different mechanism of injury. So you want to ask, specifically about like what happened, how did it happen, how did baby react right after it? So important questions. So what's an important question about the past medical history or maybe social history? I think it may so probably go under social history that you want to know for kids. So what's important for the social history in kids, or maybe past medical? What is important that you want to know for kids, especially with injuries, with wounds? What is important to know? One of the important questions you want to ask. Any allergies, of course, you want to know about allergies. Always want to know about allergies in kids, but you'll also want to know about allergies in adults. Any head injuries in the past, you can ask that. Have they, I mean, it's not what I was looking for. Are they on any medications? How does she relate with outsiders? No, that's not really important in this case. History of abuse, not necessarily. Any previous similar injuries, has this ever happened before? Those aren't, you can ask those, but that's not, no, not domestic abuse. If they have like, if it's like, you'll learn about like things that are suspicious for abuse as far as the pattern of the injury, but this is just a head bump, so it's not like any abuse type things. Medical conditions, you can ask that, but that's not what I'm looking for. Think about kids. What is specific to kids? I mean, you'll ask everybody this, but when you have a pediatric patient, you're always going to want to know this. Ask all your pediatric patients this. Vaccinations, yes, Zach. Yes. Always ask about vaccinations. For any open wound, you want to know about tetanus status. For kids specifically, you want to ask about vaccinations, making sure that they're up to date on their vaccinations, okay? Because you want to document that they're up to date on vaccinations, or that, parents choose not to vaccinate or whatever it is. So for kids, remember to ask about vaccination. But for both adults and kids, of course, with wounds, you want to ask about tetanus, making sure that their tetanus is up to date and that they don't need a booster shot. Blood problems, not necessarily for kids. If they have no medical problems, you don't really necessarily worry about bleeding in kids because they don't have those type of issues that adults have or older patients have. And they're not going to be on blood thinners at age 3 unless they have congenital disorder. So what I was looking for is vaccinations. Good job, Zach. All right. What systems do you want to assess? So for any injury, you want to, of course, if it's a wound, you want to look at the derm. You want to look for swelling, redness, any bleeding, of course, if it's actively bleeding, any looks like an arterial bleed versus a venous bleed, or yes, it's swelling, any other deformities, any abrasions, anywhere, any trouble moving, you want to do a musculoskeletal exam, any signs of tendon injury, trouble moving that arm, because then you want to do an x-ray or other imaging, not that arm, or if it's an arm injury or extremities, and you want to check, make sure that they don't have any trouble really moving it, that they can walk, look for any other, touch other joints. Let's see, for derm, you want to see how deep the wound is, if it goes deep into the fascia, if you can see muscle involvement, bony involvement. If you see bone, I would get orthopedics involved. And of course, making sure that, covering them for any possible infections depending on the type of wound or the type of injury. And we'll talk about that later. Alrighty, so I covered that for you guys. And of course, always listen to heart and lungs, but mainly with injuries, especially open wounds, make sure you do a proper dermatology, derm exam, skin exam, whatever you want to call it, and musculoskeletal. I mean, face, not so much musculoskeletal, raising their eyebrows, smiling, whatever, but arms, make sure you do the musculoskeletal, make sure you check out their tendons, make sure there's no tendon injuries, especially with the hands. Hands are so important because people need their hands. And I went over derm already. All right, so, assess the patient. You spoke with mom, you got what you can from the 3-year-old, you looked at the wound, and then the next thing you got to figure out is, does this patient even need sutures, right? Because you got to close it, and are you going to close it with sutures? Are you going to close it with glue? Are you going to close it with staples? Does the patient need any of this? Can it just heal on its own? Oh, another question that we forgot to ask, another important question is, when did it happen? Even though, clearly, of course, let's say this happened today, but important to document is if it did happen today or not. Let's say mom said that did happen. I actually forgot to put that here, but it happened 3 hours ago. Time is very, very important for wounds, because if it's been more than a day, you cannot close that wound. Maybe sometimes if it's a really bad wound on the face or different, depending on the location, we can get plastic surgery involved, or you got to weigh your risk and benefits. But when a wound stays open, bacteria is already basically in there. So you're closing it with that bacteria there. So we just basically let it close on its own when it's been that long. If it's the hand and you let more than a day go by, we're not closing that. But if it's the face, I think sometimes they do, because especially if it's disfiguring. So, but time is really, really important. I totally forgot to mention that. I forgot to put the time, but it happened today. It happened 3 hours ago. But if mom came in and said it happened yesterday, then I would probably talk to my attending, and they may or may not get plastic surgery to really make sure, or the attending might say just close it up, because you don't want to leave a bad scar or whatever. Close it up, put the patient on antibiotics, make sure you clean it really well, while, or they may not close it at all, or that we may try to see if plastic surgery wants to do anything or whatever, if they have plastic surgery. But it's really tricky when it's the face and figuring out whether to close or not after 24 hours. You can also look at the literature, what Up to Date says, but if it's any wound, you just know 24 hours is not too good to close. But face and really disfiguring wounds, like if it's like all across, I don't think anybody would wait 24 hours to come fix a wound that's across their face. But yeah, just know that 24 hours, you don't really want to. Or you can do steri strips if it's not too big. You can do some steri strips to kind of close it or let it fully close on its own. Steri strips are like little stickers that bring the wound together or bring the edges. To suture or not suture, what do you guys think? Happened 3 hours ago. This is the wound. I'll let you guys take a look at it again. So to suture or not suture, you got to know this. You got to figure out whether you're going to close it or not. To suture or not suture. Suture, Hamlery. Suture, Sarah, Johanna, suture. Yes. Good job, guys. Good job. So yes, this kid is going to need sutures. He qualifies for it. Why not? Does the deepness of the wound matter? Yes, and I'll explain why in a few. So yes, definitely suture this kid. You don't want to send a 3-year-old, especially kids, home with wounds, like especially kids, young girls, teenage girls. You want to be really careful because, aesthetics. You don't want to leave a bad scar. So sometimes plastic surgery can do it, like if it's a really bad wound, to minimize scarring. But you definitely want to suture. There's no contraindication of suturing in this case. All right, so we're going to suture this kid, and we're going to talk about all the stuff. We're going to touch bases on suturing. All right, to image or not image. These are all the things you're going to be thinking about with wounds or with injuries. To image or not image. And by imaging, I mean a CAT scan of the head. To image or not image, guys. Image or no? Imaging or no? Good job. Okay. Alrighty. So I would do no imaging, and I'll explain why right now. So these are kids. They're not like adults. It's really hard dealing with kids because there's all these factors. They barely live their lives. They have all these years of radiation to accrue. So you want to be really careful when imaging children. You want to really, really have a reason to image kids, especially a head CT. You want to reduce the risk of radiation exposure. So they created these rules, just like I was telling you guys a few weeks ago about PE rules for diagnosing and ordering D-dimer and different tests for a suspicion of a pulmonary embolism. There's rules for a lot of different other tests, whether you want to do a lab test or imaging test, or you want to figure out the risk stratification of certain things. So they create some of these rules based on studies. So the PCARN rules, they didn't really teach me this in PA school, to be honest. I learned this on rotations, but it's really important for if you're going to get into the ER to know a lot of these rules. You don't have to know the exact things. They'll come to you, but just know that, PCARN, let me rule it out. And you go on MD Calc. MD Calc is a really great resource. If you guys don't know about it, you got to know about it. But it tells you it's like a medical calculator for all these things. So you put in I'm going on MD Calc right now. So you put it on the criteria or whatever you're searching, and then you answer some yes or no's, and they'll tell you whether they recommend it or not. So same thing for PE, Wells criteria. Same thing if you suspect, if you think whether a patient should get admitted for a possible stroke or TIA or not, and it'll tell you. So it's just it's a great, great resource. I think I have the app, but I don't. So it looks kind of like this, but you answer some questions and they'll tell you what the recommendations are. All right, so this kid is older than 2. So it's based on whether the child's younger or older than 2. So this kid's older than 2. This kid has no altered mental status because, of course, you do a head CT to make sure that there's no traumatic brain injuries, skull fractures, brain bleeds, anything bad going on from this injury, right? So, and to help you, because you don't want to CAT scan a kid every time they, fall or bump their head. They're 3. They're going to fall all the time. They're going to hit their head all the time. They're going to, get boo-boos all the time, right? So you want to know, when should I really do this or when should I not? So these help you determine that. And if you document that you ask these questions, they answer these questions, that PCARN is negative, that, based on PCARN criteria, whatever, no CT indicated, that covers you. So, or that helps you, that really helps your documentation. So kids 2 years old or older, so we're going to use the right side. Altered mental status, or GCS. GCS is Glasgow Coma Score. The GCS is 15. The kid's alert, moving, eyes open, move spontaneously, eyes open spontaneously, all of that. Speech is good. No signs of basilar skull fracture. So that's good. Perfect. Go to the next side. None. History of loss of consciousness. Remember I said vomiting. Vomiting can be a sign of neurological impairment, something going bad in the brain. No headache, severe mechanism of injury. This is really the part that's the gray area. What's severe or not? What is considered severe or not? If the kid's 3 and running, 3-year-olds are not the fastest runners, right? And he hit the coffee table. Is that considered a severe mechanism of injury? Possibly not, as compared to being hit by a car or an MVA, or being in a car seat and the seat flying off and hitting the window or dashboard or something. Those are more severe mechanisms of injury. So you answer all these questions. If you answer yes or no to some of them, it'll say recommend or recommend watchful waiting versus CT or recommend CT. So it always comes down to no CT, or observation. Observation means that you tell parents to monitor the kid. If they do show signs of these things, to bring them back in and you do a CT. So so the kid has none of these. If they have none of these, then the recommendation is no CT. Okay, so our kid had none of these, so no CT. These all help you. And this is what medicine is for, to help you get a diagnosis or to help you determine the next steps. And like I said, MD Calc is a great website or app. All right, so PCARN, no imaging. Our 3-year-old does not need a CAT scan. If our 3-year-old did have a severe mechanism of injury or was constantly vomiting, or mom said he passed out, it was hard to wake him up, then we would go and do a CT. Usually if they have any one of these, I would just go, cover myself, do a CAT scan. So no imaging, guys. If it was an adult, of course, probably an adult, based on, of course, mechanism of injury. Adults are not bumping into things every single day, and adults, they're older, they can handle the radiation. So it's not as, crazy for adults as it is for kids. All right, so we're gonna suture this kid. So sometimes you can do glue. I wouldn't do glue on this kid because glue is a dermabond or just like an adhesive glue, and it brings the wound together. You can do glue on the face. You don't do glue on extremities because, it's such a high tension area and it can open. But this kid, I wouldn't necessarily do glue because it's so open. If it was more superficial, then you can do glue. But the glue might not work on this kid because it's more open. So I would just do sutures. And he wouldn't really need that many sutures. But so the next step is to determine suture, right? We're going to suture. So depending on where you work, most hospitals should actually have a suture kit where it's a kit that has everything that you need, okay? Except for what's on the left. What's on the left, they would actually have in stock in the, supply closet. But they should actually have a suture kit with all the things. Oh yeah, gloves. I forgot to put gloves. You're going to need sterile gloves. I forgot to put gloves in that picture, but sterile gloves are different from latex glove or the nitrile gloves or whatever. Sterile gloves, because this is a sterile procedure, right? You want to minimize risk of infection, so it has to be done sterilely, and you're closing an open wound, so it has to be sterile. So you're going to have a kit. Some urgent cares, some other places might not have the kit. You kind of have to put it together and look for all the different stuff, but most places should have the kit on the right. That's your suture kit. You're going to need some stuff to clean the wound and to numb the wound. So I like to, depending on the wound, I'll numb it and then clean it, or I'll numb it a little bit, clean it, then numb it some more. Of course, that's not necessarily sterile because you're, kind of moving back and forth. But once I actually start doing, suturing, then it's completely sterile. So the most important thing is cleaning. The most important thing is cleaning. If this is one of your quiz questions, then you already got one right. The most important thing for wound care is wound care. Making sure you clean the wound correctly and properly. Take as much time as you want to clean that wound, especially if it looks like a dirty wound. His wound looked pretty clean, but you're still going to want to clean the wound. That's how infections happen. If you don't give proper wound care, you're not cleaning the wound properly. So some people don't like betadine, but I use betadine. Some people just use sterile water or normal saline to clean it. Just flush it, flush the wound, look for any foreign bodies, look for any, chips of wood or whatever. whatever from the coffee table. Make sure, I doubt there's any of that, but look for all of that, okay? So clean the wound, making sure as clean as thoroughly as you can, and that's how you reduce infection, okay? So you're cleaning the wound and you numb the wound, and it's a forehead, it's a small area, so you can put like of course you don't want to put more than 5 cc's in certain areas. I would probably, if it's a kid, like do 3 cc's in the forehead, and usually I think that numbs in 3 cc's, especially if it's such a small wound. Of lidocaine 1%. It's not that strong, 1%. So you numb it. Usually they'll be going crazy, and then you numb it, they're fine. So I'll take my phone, I'll put on Paw Patrol or something like Coco Melon, something on YouTube for them to watch, and they start watching it. And I'm gonna say, you're just gonna feel a little stick, a little prick, a little, just a little poke, and then that's it. So I poke them, numb it a little bit, and then give it some time, a few seconds, and I poke around with the needle, see if they feel it, and then I'll start suturing once I get my sutures, okay? So you want to make sure you numb them well. They don't really need more than 5. It's like the wound is small, so it wouldn't be more than like 5 cc's I would give like 3 or 4. I mean, it's a kid too. So let's see, suture kits, suturing. All right, so I'm not going to go into everything about suturing. I'm just going to tell you guys that you're going to choose a thread size. The thread is going to be like how thick it is. High tension areas, you want a thicker thread, or, something that'll be more taut, like so it won't pop. The sutures won't pop, right? So before I go into that, and then like low tension areas, or like areas where the skin is not as thick, you're going to use, more skinnier thread like this one, right? So like the arm, your legs, your thighs are going to use, and it's going to go from the highest is going to be like the skinniest thread, or like, not so high tension or threaded or whatever. So 5/0 you can use on the face. 5/0 is 6/0. It's a very small, skinny thread, right? Like this, like that picture. And then 5/0, 6/0 on the face, because it's not such high tension. And then like 4/0, 3/0 like on the extremities. 2/0, 2/0, 1/0, whatever. Like the lower it gets, the tougher the thread is. Okay, so you'll use those on like your large extremities, your thighs, your legs, your knees would be like a 3/0 or a 2/0, because you're walking on your knees. You don't want the sutures to pop. You want something that'll really get it together. So 5/0, 6/0, I would use on the face. And then you don't want to use something really with so much thread, because you don't want to leave such scarring. So this is really small, and you would use that. And the thread is gonna be so tiny, you'll barely be able to see it. And then you're gonna pick a right needle size. There's different swags, that's what they call it, or not size, needle shape. So you'll see all those, be able to play with them when the time comes. I'm not going to go too in depth. Oh yeah, and then the type of thread. So there's ones that are dissolvable and ones that are not dissolvable. So Ethylon is not dissolvable. And you want dissolvable ones for internal sutures. So like when you do surgeries, you suture, like say you got to suture an artery, or like an artery, they have a bleed or whatever. You can suture different things inside your body, and you want to make sure that the suture dissolves on its own, because you don't want to go back and open up the body to take out the sutures, right? They dissolve on their own. So dissolvable sutures are for internal. So say somebody has a really deep wound and you put 2 layers of sutures, right? You're going to first put dissolvable, and then the second or final closure is going to be non-dissolvable. The dissolvable ones are going to end in like krill, like bicryl, monocryl, whatever, like CRYL or RYL, and those are chromic gut or whatever. So those are dissolvable, which means they don't have to be taken out. They'll dissolve over time. The ethylene, proline, those are non-dissolvable. These, like ethylene, is not dissolvable. So the patient has to come back in to remove the sutures. So let's say we put 5/0 ethylene in this patient. So we picked our sutures. We've got our suture tray. We're done. It takes us about like an hour for everything to get done. Calm baby down. Boom, it's done. Hip, hip, hooray. We got a nice little wound together. Okay. Now kid is happy. Just going to leave a little scar. We can put some, bacitracin on that, some Moderna over time, so he won't have a crazy scar as he grows older. Maybe by the time he's 15, you can barely see it, right? So then next step. now the child's going to be able to go home, right? Because it's, it's just suturing, injury, whatever, a little wound, put it together, fix it for the baby. Now it's time to go home. So antibiotics or no antibiotics? Antibiotics or no antibiotics? These are all things that you got to be thinking about with like wound care. Hamlery, good job. Okay, it's a plus or minus, Hamlery. So for this case, so it varies. Some say yes, some say no. It really, really varies, okay? You don't always have to give antibiotics for lacerations. It's not a must that you give antibiotics. If it's a clean wound, if it's like a face, like if it's like a little like a kid like that, like it's just this little bump on the face and had a little cut, you don't need antibiotics. If it's like a hands and feet, the pearl or what I've learned from my supervising from doctors, hands and feet, you give antibiotics. Always give antibiotics for hands and feet, or a doctor recommends giving antibiotics for hands and feet. Other than that, it depends on the mechanism of injury. Say like they're, it's an adult and he's like, a construction worker or whatever, and he cuts his arm. Definitely give antibiotics. He's working with all these metals. He's working at work. He's working in the dirt, whatever. Definitely give antibiotics, right? It depends on the mechanism of injury. You want to use your, clinician, your reasoning, thinking about, oh, should I do this or not? Like, you consider a lot of things. And this kid, no, but if it was a mine worker or whatever, a construction worker, a scientist, how did they injure themselves? Did they injure themselves with a dirty knife? Antibiotics. Okay. Did they injure themselves in their hand, their feet? Antibiotics. Did they have a big gaping wound? Antibiotics. Okay. If it's something small, something minor, something small, like a little cut on the face, not necessarily. You can just give a little antibiotic ointment, but not oral antibiotics. So yeah, hands, feet, extremities, I usually give antibiotics. Faces, like the face, you can give a little cream. Initially, you don't necessarily have to give antibiotics. Yeah, if a person comes and they didn't choose to, it's been over 24 hours and you're not going to suture it, I would definitely recommend antibiotics, especially if you're not going to suture it. So if it's beyond 24 hours, dog bites, animal bites, antibiotics, human bites, antibiotics, okay? And a lot of human wounds, you do not close them. If it's on the face, sometimes they'll close the face wounds, like especially disfiguring wounds, but dog, animal, human bites, do not close. Give antibiotics. Give antibiotics. Sometimes they need 2 if they're allergic to penicillin, okay? Give antibiotics for animal, human bites. But like regular lacerations, like injuring on something, bumping it, cutting yourself, it depends. All right. So discharge instructions. There's the baby or mom is going to leave with like an educational pamphlet, but more importantly, you don't just give them a pamphlet and say, oh, read this. You want to voice these things to mom. You want to talk to mom. You want to make her feel comfortable. You want to make her feel like, everything's going to be okay when she leaves the hospital. That baby's going to be okay. What to look out for, what to treat, what to not treat, how to treat it. Okay. So these are the discharge instructions you're going to give to the parents or the patient. Okay. For wounds, no direct water the first 48 hours. Then you can clean it with regular water. They don't need to use hydrogen peroxide. They don't need to use betadine. They don't need to use all these crazy solutions. Just regular tap water is fine to clean it as long as it's clean. And if it's, and it's fine to leave open to air. You don't have to, we actually don't want you guys to cover wounds all, like the first day, of course, maybe, but the first day or 2, but afterwards it's fine to leave it open to air as long as, you're not going to get it dirty somewhere, as long as you're not going to go to work and you're not working in a minefield or, around dirt. If you do, then cover it up. But when you're covering it, it's just harboring more bacteria because like it's in a moist environment. So if you're just at home, it's okay to leave it open to air. If it's, little, suture, whatever laceration, it's especially once it's closed and just, healing, it's okay to leave open to air. Okay. Monitor for any signs of infection, redness, swelling, warm fever, all the signs that comes with infection, changes in behavior, and return to ED if developed. Monitor for changes in behavior. Remember, I was telling you guys this about CT or no CT. Monitor for changes in behavior, vomiting, severe headache. If the kid's like more somnolent, more sleepy, that's somnolent, then come back to the ER. And then suture removal in 3 to 5 days. There's different suture removal times depending on, where the sutures were placed. Like hands and feet take a little longer to heal, so that's about 10 to 14 days. The face is like 3 to 5 days. The scalp is like 5 to 7 days. So it just depends on where they got sutures. So in this case, the kid can come back in like 5 days to get the sutures removed. And then remember we were saying antibiotics or no antibiotics. In this kid's case, he doesn't really need antibiotics. We can just treat it with like a little ointment, like antibiotic ointment. Okay, he doesn't need oral antibiotics. When I say antibiotics, I mean oral antibiotics by mouth. We can just give him a little antibiotic cream, you know, triple antibiotic or pacitracin, mupirocin, a little ointment or a cream. You can put a little bit on it after the first few days. And then, you know, you can, if you're worried about scarring, give him a little Moderna, a little scar cream put on it after the sutures are removed. And then boom, that's it. The most important thing though is to tell mom to look out for any signs of infection, any changes in behavior. Because remember, we did not do that CT, so we want to make sure that baby is okay. And of course, look out for signs of infection. If the baby does develop an infection, that's fine. That does not necessarily mean that you did anything wrong. Things happen. That just means that he needs an antibiotic now. It doesn't always mean that, oh, you did something wrong, or your technique was poor, or your sterile field was like messed up, or you didn't, you know, do what you were supposed to do. Sometimes people develop infections. If they're diabetics, oh yeah, when I was saying antibiotics or no antibiotics, also remember the patient's immune system. Sometimes even if they have like a regular fine wound, but they're diabetic, or they have HIV, or they have cancer, just always give them antibiotics because their immune system is not that great to begin with. So it's all a case-by-case basis, okay, you guys? But always just, you know, using your proper judgment. But yeah, I said bacitration, little ointment. Tell mom to come back for suture removal. Give her some, you know, precautions. And of course, you know, just come back if anything. Give us a call if you know, any questions, whatever. And then baby's happy. End of the case study. All right. So as usual, make sure your document. Know what's common. Know zebras. Know what can kill you. And I'm here. You guys, this was I hope it was a quick case study. I'm not sure. So I hope it was a helpful case study. I hope you learned as usual. You can always watch the replays. Replays will be up soon. And that's about it. Hope this was helpful. Of course, I'll post my social media, email. Well, just contact me on the app. Feel free to message me on the app, guys. I hope this was informational and educational and helpful. Good. Glad you guys liked it. No problem. Alrighty, guys. No problem. All right, guys. So I have to get going. How do we access the quiz? eshadowing.com. Everything's on the website, guys. I have to get going. The name of the app, the link is right here. Or if you follow me on Instagram, Rodeline Joseph _, it's in my bio. The link in my bio. All right, guys. I have to get going. Have a great night. Good night, guys. Bye.